a lot of deaths. Men are dropping like flies,
Mm-hmm.
and there's no need. There's
Indeed.
no need.
All right. So, as a result of that, we played a song "Cancer," where this young man lost his mom and dad, and you've decided to go and pull together some information about breast cancer. And listeners, again, remember, we're just passing on information for you to think, for you to go out and research, talk to your doctor, and find out more. We're not giving advices here as to what to do. Is that correct, T?
That's right. We are not medical professions. We are just citizens just like you who are, trying to get informed and see what's going on because there are trends that are taking place. And unfortunately, a lot of the trends are negative health trends, and cancer happens to be one of those trends. Yeah. And the health trend is following the negative food trend. And, unfortunately, this is what's going on. And if we don't talk about it and educate ourselves and at least open ourselves up to researching, like I keep saying now with information online, you can go and find out. If you're embarrassed to ask a question, go online, look it up.
Indeed.
But if you see symptoms or if you feel things, then, you have to take it to the next step if you want to help yourself or help others in your family.
Indeed. Well said. And I love that precautionary note. And the advice is to follow up with the doctor. It's simple. If you see something start to happen, basically you want to do the right thing because it's for your health. Now, Empress.
And something else, Rula, because people will talk crap in a heartbeat.
True.
Oh, we can call up this one and that one and say, girl, let me tell you, and blah, 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 blah. Uh-huh. But about your health, nothing.
Yes, well said, well said. So, so for today, just outline how you're going to approach just lay out your presentation in terms of introduction, and you name it. Just give us an overview as to how you're going to approach it today. We want to see if we can finish by at least 11:30 because we have a little mini concert for Toronto Queen. So go ahead, please.
Okay. I'm going to just, it's going to be really brief and just, factual and a lot of emotional too, just because it's our bodies. Mm-hmm. I'm going to first talk about what the breasts are and what they're supposed to do. And, along with the prostate cancer and my theme generally is that our bodies are not being taken care of and not being used in the way that they're designed. Mm-hmm. So that breast, now that's a male breast. If you could show the slide of the female breast, the breasts have one function only. Mm-hmm. And what the breasts are designed to do is to provide milk for infants and babies. Okay? Mm-hmm. It's our body's personal milk supply for our children. Mm-hmm. That's what the breasts are for. And what the breasts consist of lobules, lobes, and ducts. Mm-hmm. That's it, and tissue, fat tissue in there. And again, if you understand that the primary function of breast is just to produce milk, and it's part of the lymphatic system, then, that says a whole lot. So that what's happening in our society is that we're not using our breasts the right way. Young girls are developing their breasts a lot sooner than before. And so what happens is when these breasts are developing, they develop tissue that are very active tissue, but they're not maturing because they only go to the first stage. Mm-hmm. Each body, like our bodies go through certain stages of development. You know that we have our pre-puberty, then you have puberty, then you have, where you're reproductive, then you have your perimenopause, and you have menopause, and so that we go through different sexual stages of development. And during those stages, our bodies function and cycle in certain ways. And so what's happening basically is that these cycles are being interrupted. Mm-hmm. And when they get interrupted, they cause blockages. So that you see where we have the green on the slide are the lymph nodes.
Yeah, the lymph nodes. Mm-hmm.
And then the pink fluffy things, they look like little cotton candy things there. Those are the lobes. That's what produces the milk. And there produces the milk. And then when you see the gray streams, those are the ducts. That's what brings the milk outside through the nipple to the baby.
Okay.
Okay, so that their cancer can either form in the ducts or in the lobes. Now, what's important about breast cancer is that because of where the breasts are, and you see how they have the lymph nodes, it can spread to the body quickly via the lymph nodes. The lymph nodes are responsible for the fluid transport in the body, all kinds of fluid. It could be the sweat glands, I'm sorry, I'm stumbling. The sweat, the milk, because I was focusing on the breast. But we're going to speak about it specifically for the breast. They have to do with the fluid production and the fluid movement in the body. And so being that the lymph nodes are right there, if you contract cancer in your breast, it's most likely going to go through the rest of the body via the lymph nodes. So that it's, it's a very delicate area. And we have lymph nodes all over our body. In our head area from the neck down, under our armpits. I believe there's some in the groin area, and one or two in our arms. And so those are responsible for the fluid transport. So this is a good slide. It's a male breast, but if you can find the one with the female. So what happens with breast cancer is that if the lobes get infected, the cancer can either stay there, or, as I said, it can quickly move through the duct and then quickly move to the body. Now, what's going on with the cancer is that it's getting out of control with the breast cancer. Women now are, I think last year they had 190,000 new cases of invasive breast cancer.
Wow.
And like 60,000 cases of non-invasive breast cancer. But back in the 70s, there weren't even so many. It was never as prevalent as it is now. And so, people are saying, well, what is it that's causing it? The other factor is that white women tend to contract it more than black women. However, black women contract a different form that is more aggressive and that is more deadly. Or should we say the mortality rate seems to be higher. They're not really certain if it's higher because it's actually higher or if it's higher because we, like our male counterparts, are not going to get treatment as soon or just going to get, tested as soon. So that by the time we do get to the doctors, it's so out of control that the only thing left to really do is to try and contain it and just, maintain for as long as you can. But usually by that point, it's too late.
Interesting.
Go ahead.
No, I was just going to say, and I know you're focusing on breast cancer in women. Hopefully you get a chance to even a minute to talk about breast cancer in men, because it does happen as to what are the differences. But go ahead.
Well, again, let me just touch upon this. The things that there are certain risk factors for breast cancer, because some people say, well, what is it that, how come so many people are getting this breast cancer now? My main thing is, how come all of a sudden now there just seems to be every woman is getting breast cancer? It just seems like it's everyone. Before they said, oh, it was a certain age group. It was after 40 years old. They wanted you to get tested because that seems to be the higher age bracket. But now it's getting lower, and there are certain reasons and certain risk factors. So I wanted to just touch upon some of them. Some of them, the main one is family history. So that if you have a relative, your mom or your grandmother or aunt or someone that had breast cancer, then chances are you're going to have breast cancer. That's what they say. And that's connected to a gene. And there's the gene is the BRCA1 and BRCA2. And without getting too technical about it, these genes are what is responsible for breast cancer and ovarian cancer. And on a good day, the BRCA1 and the BRCA2 are supposed to repair your DNA so that they keep your gene structure intact so that your body is regenerating the right way. You know, that when you nick your skin, your cells are growing back. You know, you're not growing back 5 extra layers. It keeps everything in check. But what happens is when there's a mutation of that gene, it doesn't work. And so then your DNA can get out of whack. So if there's any mutation, anything goes wrong or strange in your body, there's nothing to keep it in check, and there's where the cancer cells are able to grow because there's nothing to keep them in check, and they're just growing out of control. So are you following me?
Yeah, well, yeah, we're with you. We're with you.
Okay. So that
if you want me to change the slides as you go ahead, just
you can leave it right there. That's fine.
Okay.
So that along with with family history, like I said, there's the genetics. So if you have a blood relative on both sides that was diagnosed before the age of 50, then they say the chances are you can get breast cancer. If you have a family member that had breast cancer or ovarian cancer, or any other gland-related cancer, chances are you can get breast cancer. And the same with if you have a male in your family that had breast cancer. I know Ruba said, you mentioned about breast cancer in men. It is a possibility, but it's not like a high possibility. So that where we would have 1.3 per 100,000 men contract breast cancer in comparison to 124.3 per 100,000 women, it's not that high. And the reason is because of the function, again, of the breast. So that, the breast tissue in men do not grow the same way that the breast tissue in women grow. So that's why the likelihood is a lot less. But there are conditions in certain instances where men can contract breast cancer because they have enlarged breasts. Sometimes the breast tissue in men grow larger, or if the men are a little heavier, they may have more breast tissue there. And just by virtue of the fact that where it is, the lymph nodes and things like that, you can still contract cancer in that area. But it's not exactly the same way as women.
Let me ask you this. Don't know if you know the answer to it, but if you don't know, I understand also. You see some of these men that bulk up with big breasts based on they probably take, really working out hard, probably taking supplements and all that stuff. Does the chance of those persons getting breast cancer, those men, does it increase?
Well, yes, because they're increasing their tissue mass.
Okay, so that's the key then. The
key there is the tissue in that area too.
Interesting.
So again, but there's like last year they reported 2,350 cases of men with breast cancer.
Oh,
okay, and out of that, 440 died. So it can happen, but it's not as common as with women.
Yes.
And again, it's because of the way that the breast function. And there are symptoms of breast cancer in men, and they're very, very similar to the symptoms of women. So that if you felt a lump or like a hardness in your chest or breast area or under your armpit, and so, it might be, it's not really painful, but a little tender. Or if there's a change in the size or the shape of your breast, or if you see any dimpling in the skin or redness or anything like that, itchiness or scaliness of the skin, or if you get like a rash on your nipple, or let's say your nipple starts to fold in, or if you notice any discharge whatsoever, then those are things that you want to go and get checked out. Don't wait. Sometimes it's just, like I said, inflammation, and they can treat it, quickly. But you don't want to wait, because what happens is the inflammation turns into other things. You have lymph nodes there. There's other body parts. It's not just, we're not like a robot so that everything works independently together. Everything works together. It's all fused together, and everything vibes off of each other.
All right, Empress T. There, as you speak, a lot of information is being entered in the chat room. So if you get a chance to eyeball anything there and you want to answer it or comment on it, please feel free. Folks, the phone number is
Okay.
770-744-2154. Sometimes it's probably a little easier if you were to call in and articulate your questions or comments to Empress T for to provide feedback, because she's going through her notes and sometimes to really read over
Yeah.
in the chat rooms, because there are a couple of chat rooms open. It might be a little cumbersome for her to do so. So feel free to call in. The number is 770-744-2154. We know there are many, many people that are listening. I want to say thank you for tuning in. All right, Empress, go ahead.
Okay.
Sorry, go
And
ahead.
so some other risk factors are pregnancy. Apparently, if you haven't had a child or, say, a full-term pregnancy before the age of 30, that puts you at a higher risk. Apparently, when you have your first full-term pregnancy, it helps to bring your breast cells to maturity, and allows them to function and drain and do the things that they're supposed to do. So that's also a risk factor. And also a lifestyle change that, we've made in society. People are having babies later and later. And while it may make economical sense, physically, it causes, I want to say, little hiccups in the mechanics of our body, because they're designed to work and operate on a certain time schedule. Yes, we can not really skip steps, but we still have to follow the stages. And, girls are developing quicker, so it seems like we're skipping some steps, but we're really not. What we're doing is putting a strain on their system, because now those breast cells are there, and now they're waiting longer to reach maturity, and there's where you have more potential for abnormalities and mutations of the cell.
All right. Yeah. While you sort your notes there, let me just add.
Yeah, if you could pick up some questions
and
for me, then I can do it. And then also the same along with that is, the menstruating cycle of girls as well. Girls are reaching puberty much, much younger nowadays. Mm-hmm. And again, as I said, that since that's happening, the breasts are developing sooner, but they're not able to mature until much later, because they still, a girl cannot have a baby and do all these things at 13, 14, although some are, but, technically they're not supposed to. So it's putting a strain on the system. And what happens is these cells, because they're not being used and not being able to mature, the estrogen gets out of control, and then the cells become sensitive, and then, there's more potential for picking up cancer.
All right. We have like 37 persons locked in the chat rooms on Ruler Brown Network, the two chat rooms, and it's 51 minutes after you're listening to Empress T giving some information. This is mainly information she's researched that she's sharing as part of the series of High Frequency about breast cancer. Let me just add one thing here. Toronto Queen says the bodybuilders use steroids to bulk up. She says she was a Canadian national bodybuilding judge for 10 years. Wants a big up to Toronto Queen, who has a birthday today. And she says she says it was heartbreaking to see how they wrecked their bodies with the steroids. Liebach went on to say there was more concern, I'm a bit wondering SWC. So what does it mean when someone has cystic breast, and are they more at risk?
Well, it all depends. There's so many different types of breast cancer. That's the other thing. There are so many that like when I was going to go through each one, I would need a couple of sessions to go through each and every type. There's some that come as cysts. There's some that come as tumors. It all depends on the location. It all depends on what started it, where it started. Did it start in the lobe? Did it start in the duct? So that when we become technical like that, that's the kind of things that you have to go and look up. I don't think anyone is any worse than the other. It all depends on where it is, and I think it more has to do with the stages of the cancer, just like with the stages of the prostate cancer, than anything.
But and again, here the advice would be the first sign of anything that you're uncomfortable with, that don't know what is happening, go and see a doctor.
Yes, definitely. Like I said, any lumping, any changes. There's a diagram there that shows, the different signs that would send you. If you see your skin lumping or wrinkling up, that's a sign that you may need to go and get something checked. Depending on the stages of the cancer, you're going to have different symptoms. But if you get a mammogram, the reason why they stress getting mammogram is because the mammogram can detect something 2 years before any human can, or before you can even feel it, so that you can avert, or get that treatment right away, and possibly avert any further damage or any further growth. And not all cancer is malignant, so there are some benign things. But the thing is that even though it's benign, meaning that it's not cancerous, because of where it is, it has the potential to turn into something else. So that you don't want cancer there, There were some other risk factors that I wanted to cover.
All right. While you're doing that, I have the chart up. So let me just read off for some of the people who are not in the chat room and can't see it. So at least they'll hear. They say some of the things to look for: redness in the breast, breast swelling or enlargement, pain or itchiness of the breast. And I think you might have gone through those already, but just thickening of the skin on the breast, and ridged or dimpled skin texture, and also talk about swelling of the lymph nodes in your armpit or above and below the collarbone. Yeah, so for those persons who are not in the chat room seeing the chat, those are people are driving around, they're listening to us on their telephone. Those are some information that you should take a note to determine whether or not things are happening.
Right, and also any oozing at all. If you have any liquid coming out and you're not breastfeeding, then you need to get that checked out as well. Okay, so now there are other risk factors. Some of it is weight. Some of it is very simple things that you can help and sway, to your advantage. But they take a lot of consideration. Like I mentioned, pregnancy. Some people don't want to have children. But if you are considering having children, or if you have family members, then you may want to tell them that, when they say about the biological clock, that's for real. You know what I'm saying? That's for a reason. Your body is designed, and it's time. You know what I'm saying? It's on a timer, and certain things are supposed to happen within a certain time frame, or it can hiccup the next process. So that we want to, try to use our bodies for what they're designed for. I'm not telling everyone to go and have a baby, but these are just some of the things that are that put you in a higher risk factor.
Let me ask this again. Once a big up to Roddy Strut in the chat room. Sal, there are so many people in the chat room, and folks, if I'm not calling your name, I apologize, but we're running short on time and we want to cover as much as we can. But there are some like over 40 people in the chat room on Ruler Bell Network. Let me ask you, for a parent, a mom or dad that has a young one, 12, 13, 14, what kind of approach should they take in terms of talking to their young ones that age? I know it's a little early, but some of the things that you're talking about, starts at a tender age. So what would you say to a parent who is listening now that has a 14-year-old, 15-year-old, what they should look out in terms of their body, the breast, examining their breast and so forth? Well,
really, there's a lot I could say. Bras, because the first thing a little girl wants is a bra. That's the sign of maturity. Oh, once we get that bra, we are a woman. But what we have to take into account also is the fitting of the bra. If you can go back to the slide where you...
Is the what? What do you call it? Is the what?
The fitting.
The sitting.
The fitting of the bra.
Oh, the fitting. You're talking this photo here?
Where the bras fit is also very important. You have to get the right fit because it can press on a lymph node. It can cause blockages. It can, you understand what I'm saying? So that you want to take into consideration the fit of the bra. Make sure that the breasts are able to flow naturally, hang naturally, so that there are no, abnormal
obstructions.
Yeah, there with the lymph nodes and the ducts and things like that. because if they're starting young, they're going to have a lot of years before they actually have a baby. You know what I'm saying? If they go that route. So that they have to take care of those ducts and make sure that there are no obstructions and things like that. The other thing is diet more than anything. You want to start them young, and this is something that I always stress. You want to start them young with a healthy diet. Apparently, you know, being overweight and having a lot of fat cells in the breast area contributes to the estrogen, which contributes to the issues with the cancer cells in that area. So that you want to internally keep them eating well. They need to exercise. Don't let them smoke. Don't let them drink. These are things that bring toxins, you know, into the body. I know it sounds so simplistic, and people are probably looking for, you know, a magic formula, you know, the genie in the bottle. But there is no genie in the bottle. The genie in the bottle is that we have to take care of our bodies, and we have to be careful of what we eat. A lot of the food now is filled with hormones, so that, you know, this is what's causing the young girls to develop faster. Unfortunately, we can't stop, you know, them from putting the hormones yet, but we can be mindful of what we're eating, so that they want to eat more vegetables, more, you know, limit sugar, limit things that are going to create fat, exercise, like I said, no alcohol, things like that. If they are menstruating, you know, you want to have them get checked as soon as they're able to make sure that they're, you know, that everything is flowing fine and that, you know, their levels are good. Just keep on top of them. If they have any pains, any unusual, it's the same with the big people. If you feel anything unusual, any lumps, any pains, any swelling, warmness, tenderness, have it checked out right away.
All right, folks, it's 11 o'clock. We're going to take a 90.
You are listening to RBN, Rule Grounds Network.
All right, it's 11 o'clock. It's 11 o'clock, and we're speaking live with Empress T with High Frequency. Remember, she's here every Friday at 10:30. Keith Anthony's on every Tuesday at 10:30. One with Hypnosensi and High Frequency, and on Thursdays we do we call it Healthy Thursdays. And today we're covering breast cancer, information only, not telling you what you should do, but it's a matter of looking, just being cautious. Go to your doctor the first time you see something that you're not sure about. Go to your doctor. If you have kids, have a dialogue with them, communicate with them, let them know what's the right thing to do and not to do. And let me just say a big up to Clifton Edwards in the chat room, 25th Century Radio, also to Scorcher P, also Mr. Who's that? The Empress T, Beverly Morgan, Keith Anthony, Librock, Mightyful 13 in the chat room, Roddy Strutt, also to Scorcher P again, SWA, Toronto Queen, Sal, guest 3007, guest 6289, guest 2249, guest 6505, guest 2255, guest 6452, guest 1441. Also in Royal Low, there are so many people here tuning in. Also, let me just say a big shout out to the moderator over there, Librock, Toronto Queen, Junju, stream guest 1556, guest 22301, guest 3059, guest 3077, guest 3198, guest 43731, guest 442, guest 44331, guest 6943, guest 6972, guest 7046, guest 73761, 79711, guest 8221, guest 89451, and the others on their telephone listening in the background. I'm just giving a rundown of folks in the chat room. T, you've covered thus far, you know, symptoms, what to do, what not to do. Are there things that if you even do some of those things, right, you could still get cancer? Is that possible? Go ahead.
Yeah, definitely. I mean, aside from heredity, those things you can't really change. But in a way you can, because a lot of the stuff that causes genetic mutation comes about through lifestyle changes. Right. We live a different lifestyle now. So that, you know, where they say if you breastfeed, that's supposed to lower your risk. However, if you don't breastfeed long enough, then it's just like not breastfeeding at all. So, yeah, there's an instance where you could do something, but it's still, you end up with the cancer. You understand what I'm saying? So it's not that we can eradicate it at this point altogether, but it's things to try to thwart it, to prevent it from getting to the advanced stages.
Mm. No,
you know?
no. This stigma. A young woman out there, whatever age she is, and she has cancer. The stigma of actually once she's found out that, or even him found out that, he has cancer or she has cancer. The idea of coming out and letting others know about it. You wanna give your input as to how should one go about that? Because sometimes persons are kind of scared that other people gonna know they have certain. I know a couple of friends of mine, good friends of mine, where recently, one of them called me and told me, boy, they were seeing some signs, some things were happening, and they went to the doctor, had some checkups, and they went back, and they did certain biopsies, and they eventually called me and said, boy, Rula, doesn't look good enough. I came down with cancer, and they're looking to, well, they're not looking to, they're actually going to go ahead and cut off both breasts, such that the spreading doesn't, go from. But she also said, just keep it low profile, not to mention it to anyone. You want to address what that's like? Someone was to, get these illnesses and just the idea of going out and speaking with others. Do you think it will let them feel a little better by going out there and talking to others?
Well, it's really personal because, I've had family members that had cancer and that have died from it. Mm-hmm. Some that, did everything they could. Some that died of heart diseases did everything they could. But again, by the time that they got on it, it was really too late.
Right.
It's really emotional because, you don't want to guilt someone. You don't want people to feel bad and feel sorry for you. It's not for that.
Right.
But I'm all for sharing information if it's going to bring a stop to what's going on. Mm-hmm. Because like I said, this cancer epidemic, we can change it. I know they're saying genetics and all that stuff, but we can change the strain if we can, change our lifestyle, change some of the lifestyle decisions that we're making. We can bring about a change. Is it going to change overnight? No, because it didn't happen overnight.
Right.
So that, to me, anyone that has, those illnesses and is able to share as much as they can, I welcome it. I mean, you can help someone else who's at the beginning stages. They might hear something that they're going through and say, oh, wait a minute. That was their first thing. Oh my God, I felt that last week, and then it might prompt them to go get it checked, or maybe they'll discuss it with someone else. So you just never know. But it's in love, and the only way that we can help each other and truly heal is if we share those types of things. I know a lot of people, because I don't want this one in my business. But let me tell you something: they're in your business anyway. So why not have it be, something beneficial? Because chances are, if you're worried about people being in your business, they're in your business.
Yeah, you're right. Okay, let me just share something also additional. When I came to Atlanta about 10 years ago, I formed a cricket club here called Vibe Sports Club. And there's a young lady that came to Atlanta from New York, and she was part of our cricket club. I had to go to England for a funeral. And when I left, before I left actually, she reached out to me. She said, boy, Rula, things kind of rough. She's doing a living job. And she had to be there. Want to welcome China Nicole in the building. Blessed love to China Nicole. I know was in the hospital, just got out of the hospital. Blessed love. She says she's resting and listening. And let me go back to this scenario. And so when she called me, I went and visited her. She's doing a living job. I went and visited her. She said, boy, she needs some money. I said, well, hey, I know, whatever I can do to help you out, I'll help you out. When I went there, Sister Empress, she was taking care of a lady around 50-odd years old, kind of heavy set. And this young lady that I'm telling you about, she had a backache. I didn't know that because, like I said, I just met her here in Atlanta. She just joined my cricket club, and she just reached out to me, said, boy, she was low on funds. Could I give her some funds? So I went to give her the funds. And I saw her had to be lifting this lady. And Empress, she was under so much pain. And I said to her, how come you lifting a lady? She said, boy, she didn't have the money. That's what she had to do. Make a long story short, come to find out that she had this pain in her back. It was in her back, So then I said to her, "What are you gonna do about it?" She said, "Boy, she don't have any insurance, and basically she's been having this pain for the past month." So before I went to England, I had a back pain because I hurt my back playing cricket. So I went to the doctor and found out if it's okay for me to travel that long on a plane, 5 hours with a back pain. So I happened to have told him about this young lady that she has a terrible back pain, and could she come in and see him? And he said, "Well, does she have insurance?" I said, "No, she don't really have insurance. But look, if it's gonna cost X amount, I will chip in if I can, if that were to do that." He said, "Well, I can't do that because it's gonna cost a lot of money." I said, "Tell you what, I will go back to her, explain to her, and if she can borrow some money." She said she don't have no money, she don't know who to go to. Eventually, I went back to the doctor and explained to him and said, "I tell you what, Mr. Brown, it seems like you want to help somebody doing good. Have her come in." She came in, Empress T, and he started to do a number of tests. Come to find out, it appears as if she had breast cancer. So he sent her downtown to Atlanta to get some checkup, and it was confirmed that she has breast cancer. When I went to England and come back, as I landed, I picked up my phone, and the secretary for the cricket club called me and said, "Rula, such and such is in the hospital. Can I go look for her in the hospital?" I went in the hospital, and while I was there, the doctor was there. He came out to give her the results after these testing. I was there, so he asked her, "Is it okay for me to stay there?" Because I wasn't a family member. And she said, "Yes, he's the president of the cricket club. He can stay there." And Sister Empress T, when I saw the doctor reveal those words to her, "Your test came back, and you have breast cancer," making it official. And she was so strong. She started to cry. I hugged her until I said, "Everything gonna be all right, man." I tell you, from that day, I worked with some of the other club members to try and help her out with paying her bills. I was able to raise $5,000 for her. The bottom line is, eventually, after about 6 months, she had passed on from the breast cancer. But it's a painful thing, man. And it's the first time I've ever seen something like that up front. So you're right. If persons can communicate to others, maybe other people might pick up certain things and are able to go ahead and do the right thing and do the right checkups.
To know the risk factors, because like I said, with Black women, there's the triple negative breast cancer, and that has to do with the estrogen and progesterone receptors. So like we face different risk factors. So, it's nothing to play around with. When they say go get it checked, go get it checked. Nowadays, I know that the medical issue is a big thing, but you can find a free mammogram. Go online and look it up. Go to a women's center. They have places that will help you get a mammogram because it is so important. You know what I'm saying? And like I said, as Black women, we have the more aggressive form of breast cancer, so that when we do get it detected, it's usually way too late. You know what I'm saying? And I don't know if it's because we're not accessing the mammograms, or if it's just, low quality health care. They also say it has to do with lifestyles. Our diets are generally poor. We don't eat well. We don't keep ourselves well. Most of us are overweight. And when you're overweight, and we won't do anything about it, because for us to understand that we have the power to change it means that we have to be accountable. And a lot of people don't want to be accountable. It's easy to just say, "Oh, the cancer is taking everybody." It's not the cancer. We have to take a stand. We have to heal our bodies and change the DNA. We have to change our lifestyles. We have to use our bodies the way that they're